Close your eyes for a moment and imagine standing at the edge of a settlement in southern Mesopotamia, somewhere near what we now call the marshlands of southern Iraq. The year, as best as modern archaeology can place it, is roughly 4,000 years before the Common Era. The air is thick and wet, heavy with the smell of standing water, reed smoke, and something else. Something sour and warm that rises from the bodies of people who have no word for infection, but know its face intimately. A child has been crying for hours inside a mud brick dwelling no larger than a modern bedroom. Her mother kneels beside her, pressing a paste of crushed herbs and river clay against a swollen wound on the girl's leg. Outside, an older man chants in a low, rhythmic drone, his voice barely rising above the hum of insects that swarm over the irrigation ditches. He is not what we would call a doctor. He is not exactly what we would call a priest. He is something in between, something that this world has not yet learned to separate. Because in the world of 4000 BC, the body and the spirit are the same territory. And illness is never just illness. It is a message, a punishment, a test. And healing, if it comes at all, must answer on both planes. This is the world we are stepping into today. A world that ancient traditions, preserved in texts written centuries and millennia after these people lived, would remember as the age of the Nephilim, the age before the Great Catastrophe, when human settlements were growing, but the knowledge to sustain them had not yet caught up with the ambition to build them. According to the book of Genesis, this was a time when the earth was filled with violence and corruption, when mysterious beings called the Nephilim walked among humanity. The book of Enoch, an apocryphal text revered in Ethiopian Christian tradition and referenced in fragments among the Dead Sea Scrolls, goes further, describing fallen watchers who taught humanity forbidden knowledge, including the cutting of roots and the knowledge of plants, which many scholars interpret as an early reference to medicinal and pharmacological arts. Whether one reads these texts as theology, allegory, or cultural memory encoded in mythic language, they point to a shared ancient intuition that the earliest forms of medicine were entangled with the sacred and the dangerous, that to heal was to touch forces that were not entirely human. And the archaeological record, remarkably, does not contradict this intuition. It complicates it, deepens it, and grounds it in mud and bone. What we know about medicine in the late Ubaid and early Uruk periods comes not from medical textbooks, because writing as we understand it had not yet been invented, but from the silent testimony of human remains, from coprolites, from residue analysis on pottery shards, from the layout of settlements, and from the slightly later cuneiform tablets that recorded practices almost certainly inherited from this earlier oral tradition. At sites like Eridu, one of the oldest continuously inhabited settlements in southern Mesopotamia, and at Tel el-Ubaid, which gives the entire cultural period its name, archaeologists have uncovered evidence of communities numbering in the thousands, a people living in close quarters with their animals, their waste, and their dead. The skeletal remains from these sites tell a brutal story. Tooth abscesses were endemic. Bone infections left visible lesions on femurs and tibias. Spinal degeneration appeared in individuals barely past what we would consider adolescence, the result of years of grinding labor, carrying loads of wet clay and bundles of reeds on frames not designed for such punishment. Infant mortality, estimated from burial patterns, and the ratio of juvenile to adult remains may have exceeded 40% in some settlements. Nearly half of all children born in these communities did not survive to adulthood. Against this tide of suffering, the people of 4000 BC were not passive. They fought back with every tool available to them. Biso and the line between what we would call medicine and what we would call ritual was, for them, not a line at all. The earliest healing practices in Mesopotamia appear to have involved two overlapping traditions that later cuneiform sources would formalize into distinct roles. The first was the ASU, a word that in later Akkadian texts refers to something like a physician, a practitioner who worked with physical substances, herbs, minerals, animal fats, fermented liquids, and poultices applied directly to the body. The second was the Ashipu, an exorcist or incantation specialist, someone who diagnosed illness by reading signs, interpreting dreams, observing the flight of birds or the patterns of oil poured on water, and who treated disease by addressing its spiritual cause through chant, ritual, and the invocation of protective deities. When the fully literate periods that followed, these two roles were clearly defined, sometimes cooperating, sometimes competing. But in 4000 BC, before the invention of script, before the institutional temples of Uruk and Ur had risen, these roles were almost certainly blended in a single figure, a healer-diviner who moved fluidly between the material and the metaphysical. Imagine this figure in the settlement at dawn. The people call on him because a young laborer has developed a fever after cutting his foot on a broken reed in the marshes several days ago. The wound has turned dark. It smells wrong. The skin around it is hot and tight, and red lines are beginning to creep up the man's calf. We recognize this immediately as a bacterial infection, possibly sepsis, possibly gas gangrene given the anaerobic bacteria thriving in the marsh mud. The healer does not have these words, but he has seen this before. He has watched it kill. And he has a sequence of responses that his teacher, likely a parent or elder in the same tradition, passed down to him through years of apprenticeship. First, he examines the wound. He may press on it, smell it, note its color. Later Mesopotamian diagnostic texts, such as the Sakiku series compiled in the first millennium BC, but drawing on traditions stretching back thousands of years, describe exactly this kind of empirical observation, cataloging symptoms with remarkable precision. If the flesh is hot and the swelling spreads upward, if the patient sweats but feels cold, the prognosis is grave. The healer of 4000 BC may not have written these observations down, but the oral tradition that eventually produced them was already alive in his practice. Next comes the material treatment. From a collection of dried plants stored in a reed basket or clay vessel, the healer selects what he needs. We cannot know with certainty which specific plants were used at this exact date, but archaeobotanical evidence from contemporary and near-contemporary sites across the Fertile Crescent gives us a plausible pharmacopoeia. Willow bark, which contains salicin, the precursor to aspirin, grew abundantly along the riverbanks and has been identified in residue analysis from vessels dated to this general period. Thyme and myrtle, both of which possess genuine antiseptic properties due to their thymal and essential oil content, appear in later Sumerian medical texts as standard ingredients. Honey, one of the most effective natural antibacterial substances known, was available to communities keeping early domesticated or semi-wild bee colonies. Sesame oil, used as a carrier for medicinal pastes, appears in the archaeological record of the region by this period. The healer grinds, mixes, and applies. He packs the wound with a poultice, perhaps binding it with a strip of linen or a broad leaf. But this is only half the treatment. The other half takes place in a space we might call spiritual, but which for the healer and his patient is simply the rest of reality. Disease. In the Mesopotamian understanding that persisted for thousands of years and almost certainly predates literacy, was caused by forces. A demon may have entered through the wound. A ghost of a dead relative, improperly buried or neglected in the funerary offerings, may have seized the living person in anger. A sorcerer in a neighboring settlement may have directed a curse. The god who protects this particular individual may have withdrawn that protection as punishment for a transgression, perhaps a broken oath, a neglected ritual, or an offense against the community. The healer must determine which of these forces is at work, and he does so through divination. One common technique, attested in later texts but likely ancient in origin, involved pouring oil onto the surface of water held in a bowl and interpreting the shapes it formed. Another involved observing the behavior of smoke from burning cedar or juniper resin. Animal entrails, particularly the liver of a sacrificed sheep, would become the dominant divinatory tool in later Mesopotamian culture. But in 4000 BC, with settlements still in the late Ubaid transitional phase, the methods were likely simpler and more immediate. The healer watches. He listens. He enters a state of heightened attention that we might describe as intuitive diagnosis, or that his culture would describe as communion with the unseen. Once the cause is identified, the healer chants. The incantations that survive in later written form are extraordinarily vivid. They address demons by name, commanding them to leave the body. They invoke the great gods of water, sky, and earth. They describe the illness as a physical intruder, a serpent coiled in the belly, a fire burning in the bones, a hand pressing on the chest, and they narrate its expulsion with the confidence of someone describing a military victory. These incantations were not understood as symbolic. They were technology. They were the mechanism by which healing occurred, just as real and just as necessary as the poultice on the wound. And here is the remarkable thing that modern scholarship increasingly acknowledges. Some of it worked, not the exorcisms in the way they were understood, but the entire system, taken as a whole, produced outcomes that were better than nothing and sometimes better than chance. The herbal treatments contained genuinely active compounds. The rituals reduced anxiety and psychological stress in the patient, which modern medicine recognizes as a significant factor in immune response and recovery. The social dimension of healing, the gathering of the community, the attention of a respected figure, the narrative that gave meaning to suffering, all of these created conditions that favored survival. The placebo effect, which is not a deception, but a measurable physiological response triggered by belief and expectation, was operating at full power in these rituals. The healer of 4000 BC was practicing something that worked on multiple levels simultaneously, and the fact that his explanatory framework involved demons rather than bacteria does not diminish the sophistication of his methods. Not all patients survived, of course. The infection in the laborer's leg may well have spread beyond any remedy. In those cases, the healer's role shifted from curing to interpreting. The death was given meaning. The demon was too strong. The gods had decided. The ghost had prevailed. Funerary rituals, which at sites like Eridu included burial beneath the floors of houses with grave goods of pottery, beads, and sometimes food offerings, served to settle the dead and protect the living from further spiritual contamination. Death and medicine were not separate departments. They were phases of the same practice. For women in these settlements, the intersection of medicine and ritual was even more intense. Childbirth was the single most dangerous event in a woman's life, and it was surrounded by layers of protective practice. Later, Mesopotamian texts describe birth incantations addressed to the mother goddess. Rituals involving the untying of knots to symbolically ease the opening of the birth canal, and the use of specific stones and amulets placed on or near the laboring woman. Last, archaeologists have found small clay figurines at Ubaid period sites, many depicting pregnant or nursing women, which may have served as votive offerings, protective charms, or instructional aids for midwives. The midwife herself was a healer, perhaps the most important healer in any settlement, the one whose knowledge determined whether half the community's mothers survived the act of bringing the next generation into the world. Her tools were her hands, her herbs, her prayers, and her experience, passed from mother to daughter or from elder to apprentice in an unbroken chain that stretched back into deep prehistory. The Book of Enoch's enigmatic claim that the Watchers taught humanity the cutting of roots and knowledge of plants takes on a particular resonance when placed against this archaeological backdrop. On whatever the theological intent of the passage, it preserves a cultural memory that pharmacological knowledge was ancient, powerful and morally ambiguous. The same root that healed could poison. The same ritual that drove out a demon could, if performed incorrectly or with malicious intent, summon one. The healer stood at a crossroads that inspired both reverence and fear. And this ambivalence toward medical practitioners echoes through Mesopotamian culture for the next 3,000 years, right through to the famous laws of Hammurabi, which prescribed harsh penalties for physicians whose treatments killed their patients. If you were to visit southern Iraq today, to stand at the excavated remains of Eridu, or to walk the marshlands where these communities once thrived, you would find almost nothing visible of this healing tradition. Where the herbs have returned to the soil, the incantations have dissolved into silence. The healers are anonymous, their names unrecorded in an era before names could be recorded. But the practice did not die. It flowed forward into the cuneiform medical texts of Sumer and Akkad, into the temple medicine of Babylon and Assyria, into the Greek traditions that would eventually produce Hippocrates, who is often called the father of medicine, but who inherited a pharmacopoeia and a diagnostic method that originated thousands of years before him in the river mud of southern Mesopotamia. We carry this inheritance in ways we rarely acknowledge. The aspirin in your medicine cabinet is a refined descendant of the willow bark that a healer in 4000 BC pressed against a laborer's fevered skin. The honey used in modern wound care, now validated by clinical research for its antibacterial properties, was known to these people as a healing substance millennia before anyone could explain why it worked. Even the placebo effect, that mysterious collaboration between belief and biology, was first harnessed not in a clinical trial, but in a reed hut beside a marsh, where a chanting voice and a confident hand gave a dying person reason to believe they might live. There is something humbling about this. In an age when we can sequence a genome and transplant a heart, we are still, at the most fundamental level, doing what that healer beside the marsh was doing.
Take a deep breath.
We are observing symptoms, applying substances, and telling the patient a story about what is happening inside their body and why they will recover. Our story involves cells and molecules rather than demons and gods. Our substances are synthesized rather than gathered. But the structure, the ancient architecture of healing as a practice that bridges the physical and the psychological, the material and the narrative, remains the same. The world of 4000 BC, the world that ancient traditions remembered as the age of the Nephilim, gave us more than we usually admit. It gave us the first fumbling, desperate, brilliant attempt to stand between a suffering human being and death, and to say, with herbs and chants and unwavering conviction, not yet. If there is another era or another mystery you want to explore, another corner of the ancient world where survival hung by a thread and people found ways to endure, tell me. There is always more to uncover, always another layer of the human story waiting beneath the dust.